Mr. Jones. My name is Cassie Meyer, and I'm a nursing student at the University of South Alabama. And today I have orders to change your wound dressing, and I'm reviewing the policies and procedures to do this, and I know how to do it all. And so don't worry. I also have all the materials that I need. Yes. And okay, so let's go ahead and get started. First, I'm going to perform hand hygiene with my antimicrobial hand rub. And now I'm going to assess that Mr. Jones, your name is the same as it appears on my chart, as it appears on your name tag. So I have Jaguar J. Jones, and your wristband says Jaguar J. Jones. Awesome. And the date of birth I have on my chart is 8/25/1963, and on your wristband it says 18/25/1963 is your birth date as well. I also see that there is that you have a penicillin allergy, Mr. Jones. Do you have any other allergies? No? That's great. Awesome. So now I'm just going to reassure you, Mr. Jones, that I've already closed the drapes, and so we have complete privacy. So when I go to change your wound, that no one else is going to be in here or see what we're doing. All right, Mr. Jones, I'm going to go ahead and wash my hands to get started. When I perform hand hygiene, I'm going to be using lukewarm water and 3 to 5 milliliters of soap. And now I'm going to scan and look over my hands and fingers and cuticles and forearms for any cuts and abrasions, and I don't have any. Now I'm going to go ahead and clean every nail. Go ahead and rub over my knuckles and hands and wrists. Dry from fingers to wrists, and drop that in the trash can. Also, dry from fingers to wrists, drop that, and turn off my sink. So the reason that I use soap is for 2 reasons. First off, in between every patient, it's important to wash your hands so that you don't transmit any bodily fluids from one patient to another. And the second is to decrease the presence of microbial organisms such as Clostridium difficile. Now I'm going to move my trash can and perform hand hygiene again. And the reason that I'm going to perform hand hygiene with just the hand rub this time is because I've touched an inanimate object in direct vicinity of the patient, and I would also use hand hygiene when I take off my sterile gloves. Okay, Mr. Jones, now I'm gonna go ahead and start cleaning your wound area and taking off your old wound, and I'm gonna go ahead and raise your bed and lower the guardrails, not raise them. Okay, so I'm gonna go ahead and put on this protective equipment and go ahead and put on my gloves. adjust them since I'm only touching glove to glove. All right, Mr. Jones, let's go ahead and take off your outer covering first. All right, I see that the fluid here on your bandage shows has some pustulant fluid, and that's all right, that's pretty good. The amount is just a slight amount of fluid. The color is yellowy white. The concentration is very liquidy, and the odor, there is no odor, so that is good. Now I'm gonna take out the gauze that has already been packed in here. I'm careful to avoid touching the peri-wound area, and now I'm going to look at the wound itself. And the wound is about 3 inches across, and there's slight granulation and no eschar or slough, and no odor as well. And I'm going to touch around the wound, Mr. Jones, or palpate around the area. So tell me if there's any tenderness at all to this. I don't feel any tenderness, and you don't? Okay, great. And now I see that there's no redness or swelling around the area, so that is also very good, Mr. Jones. So I'm gonna go ahead and dispose of your dressings. And what I'm gonna do is keep my glove to glove contact and turn my hands down toward my trash can and slip this finger under the underside of my glove. Okay, so now I'm gonna go ahead and set up the sterile fields for the rest of cleaning your suture line and replacing your dressing for your wound. So first I'm going to only touch the outside 1-inch border of my tray and pull this back and push it under here. And now I'm going to pull up my sterile field, also only touching the 1-inch border. All right, and I'm gonna go ahead and dump all the items onto my wound tray. So that did not cross the 1-inch border, so we're good there. Now I'm going to go ahead and take my saline and I've checked the expiration date and it's fine. I'm gonna palm that, have my cap up, and slowly pour it into my tray. Okay, now I'm going to don my sterile gloves. Careful to only touch the 1-inch border again. Okay, so I'm left-handed, so I'm going to put on my left-handed glove first, slipping my fingers in. To keep my thumb up and I would use 3 fingers, but since my glove is improperly put on, I'm just using 2. Okay, now that my gloves are on, I'm going to go ahead and fix this problem. I think I got a size too small at the bookstore, but that's okay. Okay, now that my sterile gloves are on, I'm going to go ahead and prepare my sterile field. I'm going to go ahead and put 6 of these in here, except for this. And all right. So first off, Mr. Jones, I'm going to go ahead and clean your suture line. So I'm going to make sure this is wrung out. Careful not to touch the glove to your skin, and I'm going to clean the cleanest area of the wound first, which is the direct suture line. I'm going to go down that once, I'm gonna throw this away. Now my next gauze, bring this out. Clean down one side of the suture area and throw that away. And do that one more time for the last area of the suture line, bringing this out. All right. Lastly, I'm going to pat the area dry with a clean gauze. Okay. You might notice that my sterile field has a little bit of dampness, and that's because we've reused the gauze just recently. So it's not because I have contaminated it during this video, but because of previous gauze not drying out. Okay, so now I'm going to pack the wound with some other gauze that I need to fluff first. Drop that in there, and one more gauze. And normally when I put gauze into the wound, I would have it lightly packed all the way to the top, but I didn't realize that when I made my wound care bottle. So it is a very deep hole, and I'm only going to be using 2 gauze to simulate packing the wound. Okay, now I'm going to apply the ABD pad to the wound area. Okay, and now I'm going to take off my sterile gloves. Careful to not splash and keep my hands toward the trash can. Okay. Now I'm going to secure the area with tape. Now that the wound is secured, I would normally write my date, initials, and time that I performed this wound change and stick it on the ABD pad, so the next person after me could have a reference as to the last time Mr. Jones's wound was changed. Now I'm going to perform hand hygiene after touching a patient. So you perform hand hygiene. Okay, and now Mr. Jones, I'm gonna go ahead and lower your bed back down and put the side rails up and position you in a comfortable position. And I see that you are good. So now I'm going to clean up my sterile field and my tray and my saline. And I would also go ahead and chart that Mr. Jones handled the wound care changing very well without any pain, and his suture line is still intact. And I would note the different sizes and observances of his actual wound. All right, thank you, Mr. Jones. Have a great night.